how long is it going to take to recover from a hip replacement? Now, this is a question I get asked a lot, and because the context changes so much, we're going to dive into this video and really kind of unpick that. Now, how quickly is someone going to recover from a hip replacement? Now, this is a really important question to understand and ask, because ultimately, like, why would you do this? Why would you have a hip replacement? Well, you would have it because your quality of life is impaired and you want to have a better quality of life. Now, this is an important thing to not overlook, because quality of life is influenced by so many different factors for so many different people. Now, look, on one hand, you can have the classic hip replacement patient, old Doris here, being stereotypical, let's say Doris and Dave over here, who is like your textbook 80-plus-year-old patient who has an arthritic hip that doesn't necessarily have it through any specific cause or reason, just that we understand that an aging and an older demographic is at a higher risk. So let's say Doris and Dave here, normal arthritic hip with no other factors that have contributed towards it, having a hip replacement, versus here, you've got Doris and Dave, who might be your 32-year-old or 30 to 40-year-old young adult who has a physical job, physical occupation, and whose quality of life is influenced by their lifestyle. They're exercising, they're playing sport at a decent, consistent level. The quality of life here is influenced by two completely different situations. Now, on one hand, if someone is having the hip replacement to improve their quality of life just so they can be a bit more physical, just do things day to day and being able to be functional without pain, then to be able to get to that stage is going to be different time frame wise versus someone who is younger, fitter, but wanting to get more out of it. I.e. here, you've got someone that just wants to walk to the shops and be functionally day to day with no pain. And here, you want someone that wants to get back to running, Ironman, triathlon, physical type exercise. It might take a little bit longer for these people to get back to what they want to do, because the way that you get there is going to be different. If you have someone who is just functionally looking to get better, ultimately there's a lot of research that shows you could just be doing small and simple things and get quite a good outcome. But you cannot do the same thing for this patient, for this younger, fitter, more active patient population, because we need to bridge the gap. The surgery and the procedure is still the same, which means that enable for this person to get back to that level, it will take more input, more physio, more rehab. However, the great caveat to this is that those who are physically a little bit more able, those that do exercise, that are stronger, that are younger, that generally their lifestyle is more active, tend to be in a better position post-op to do better and bridge that gap quicker. They don't have the comorbidities, they don't have those risk factors that maybe other patient groups do, which hopefully will enable them in those early stages. Now, I know you're sitting there watching this video thinking, Mehmet, this video you promised me was going to tell me how quick the recovery timeframes are. I'm going to go through that now. But also, if you've had this hip replaced before, comment below and tell us how long your recovery was, because I'm keen to see the differences between the people watching this. Now, if you're this patient over here, the classic older patient, 80 plus, who's just trying to be a bit more functionally able, well, in reality, for that person to be able to walk to the shops, walk unassisted, live day to day without any issues, you could do that within a few months, and sometimes it doesn't even need much physio input. Versus this patient who wants to get back to running, doing exercise and certain sports, may well be a good 6-month block. But the important thing there is you're not going to be on crutches and walking frames and anything like that for 6 months. The reason why it might take a little bit longer is if you have someone who needs to tolerate impact, load of the hip through varying different levels of angles and positions and exercises relating to their sport or exercise that they need to do, well, the rehab needs to be influenced by that. And that takes a little bit of time, because you can't do the same type of rehab. Yeah, on paper, the surgery is the same, but the context, the patient, the goals, the expectations are different, which means the rehab has to be different. This is why I'm so passionate about rehab post arthroplasty, because there is an abundance of patients that go through this procedure and don't have good enough rehab. Your rehab post-op, in order to get that recovery timeframes in the same periods of time that we've discussed, you cannot get that based on just someone having a sheet of exercises with 15 different things on there that doesn't have direction, that doesn't have support, and doesn't have guidance. These patients, although, and in particular, the younger patients who are wanting to get more from it, we can't take for granted that they're all going to just be happy as Larry to crack on with things, because sometimes you've got to rein them in from doing too much. Other times you've got patients who still want that guidance. They might be a bit reluctant to get back to doing the more higher level exercises on their own. So you have to support them, you have to guide them. Our job as a clinician is to build physical resilience and build psychological resilience. These things come hand in hand. We can't take for granted that patients are able to do this thing off their own back. They need that support. But it will take months to get to that point, and to get to that point safely as well, both for this patient group and for this patient group. But there are so many factors that can contribute to a delay in recovery. And we've got things like the rare occurrences where patients can get dislocations. And we're talking minimal percentage, like less than 1 to 2% of patients will get dislocations. But it can happen, meaning that there are patients with that experience it, but that is an unusual scenario to occur. And then you have the other things like, infection risk factors, and pain level plays a role, but also you've got psychological metrics like catastrophization, fear avoidant behavior, anxiety, depression, high levels of stress. All of these components can influence the recovery, can influence timeframes of patients getting back to where they want to be, meaning that we cannot disregard the fact that these things play a role. So it's really difficult to say that every patient's recovery is going to be this lovely linear curve, and it's going to be by this month they're going to be there, because it's going to be slightly different from one to the other. And anyone that's dealt with patients, especially those younger populations who are active and who are fit and who do exercise, will know that sometimes the things that they're doing in the earlier stages, because they physically can do it, makes your heart sink a little bit as a physio, because then you worry, like, are you doing maybe a little bit too much? But then you compare it to someone else who probably doesn't expect as much from it, and you see the differences there. So the key message here with this is to realize and really understand that, one, yes, the time frames will vary, but ultimately the outcomes should be specific to what that individual's needs are and not be rushed. And this is partly why I think prehab is so important, because if you spend those early stages really building someone's ability to be confident in their hip, in their movement, in their function, conditioning them physically to be able to get ready for the surgery, but also psychologically preparing them for what they're going to be going through, that often will have a positive impact on their prognosis. And there is data and research that shows us that often those who have higher risk factors from the psychological metrics perspective don't do as well afterwards. So doing that prehab is really, really key. If you've done prehab yourself and found it useful, comment below, and if you found this video helpful as well, let me know.